بسم الله الرحمن الرحيم. السلام عليكم ورحمة الله وبركاته. أعزائي طلاب طالبات المستوى الرابع بكالوريوس طب جراحة الفم والأسنان، أهلا وسهلا ومرحبا بكم في اللقاء الرابع ضمن لقاءاتنا التعليمية في مقرر طب الفم. في هذا اللقاء سنواصل الحديث عن مراحل ما قبل وصول الطبيب للفاينل diagnosis. So we have started about taking the comprehensive clinical history, medical history in general, taking a comprehensive history and continue to explain the intraoral, extraoral examinations. In this lecture we will start about the first part of investigations. We'll specify this lecture about talking about the blood test, which is one of the specific investigations which help us to reach the final diagnosis after we perform the clinical, medical and general history and clinical examination and reaching the investigations to help us to confirm the final diagnosis. The learning outcomes of this lecture, the students should be able to describe the normal values of hematological tests and relate these findings with the systemic conditions of your patients. As we mentioned before, the patient should be examined as a whole patient, not just to concentrate in the oral cavity. You should deal with your patient as a whole patient regarding the review of systems of your patient and also correlate the findings with the general systemic conditions and will be able to correlate these findings with the oral lesions. And also you should be able to correlate the systemic conditions with the oral manifestations of those conditions. The students also should be able to order the correct needed tests regarding the blood test according to the presence of the lesions and correlation this presence with the needed clinical or the needed blood tests. The students also should be able to interpret the findings of the laboratory results of your sampling blood tests and also after interpretation of these findings correlate these findings with the systemic conditions and its oral manifestations. The references of the fourth lecture will be also the handbook of oral medicine as well as Burkitt's oral medicine. In this lecture we will talk about many topics regarding the blood tests. We will start with talking about the plasma as a main and very important component of the patient's blood and also the white blood cells, how to order the tests of WBCs in a whole picture or the differential of WBCs and how to interpret each results of the WBC blood test. Also you will need to know what is the bleeding time, what is the clinical implication of bleeding time and what is the reference range and or the normal range of bleeding time in the normal patient. Also complete blood count, we'll talk about it in detail, which is the most ordered blood test regarding the general condition of the patient and its oral manifestation. The hemoglobin level, it is also a very important component of blood test regarding the anemic patient or other or general manifestations with general conditions with its clinical manifestations, oral manifestations. In addition to the platelet count, we will know about the importance of the blood test regarding the platelet count and its relation with the general condition of your patient, and you should correlate it with the oral manifestations. Plasma is mostly water and also contain dissolved proteins, electrolytes and clotting factors and also hormones, glucose and carbon dioxide. So the plasma is an important component of the blood which contains all these molecules, and all these molecules such as protein, electrolytes can be interpreted for its increasing or decreasing values and associate or correlate these findings with the patient general condition. As we see in this graph, the plasma is the centrifuged blood. So the plasma were resulted from centrifugation of the or centrifuging the blood and specified machine in the laboratory. The centrifuge blood will be appear as this picture in the blood tube. This part is the plasma, liquid part of the blood, dilute solution of salts and glucose, amino acid, vitamins, urea, proteins and fats, as we mentioned in this part of the slide. The second part, the middle part, is what we called it the buffy coat, which is the white blood cells involved in immune system, as we know. The platelets also presented in the middle part, which importantly involved in the blood clotting. The lower part of the centrifuged tube is contain the RBCs, red blood cells, which involved in the oxygen carrying procedures. So this is the centrifuged blood. The blood cells contained in the blood are the RBCs and the Wbcs, white blood cells. We called it the leukocytes, and also the platelets. So we have the platelets, RBCs and leukocytes. The term serum referred to plasma from which the clotting proteins have been removed. So the serum is clotting factors free plasma. Blood tests can screen for systemic diseases and dysfunction like diabetes, ordering RBS, rapid or random blood sugar, and also liver and kidney function. So we can order liver function test or kidney function test by taking a sample of blood and order these tests for the laboratorist. Also certain blood disorders can be screened by blood tests like anemia, counting the blood cells, and also the leukemia, the cancer of blood. Abnormal bleeding and clotting disorders also can be screened by a sample of blood, like hemophilia, like thrombocytopenia. Hemophilia, which is an inherited blood disorder. So the patient complained from abnormal bleeding, severe abnormal bleeding. Inflammation also can be screened by blood tests like autoimmune diseases, as well as the infections like HIV, hepatitis B, and hemoglobin level, and also any infectious disease can be screened by a sample of blood. So this is how we take a sample from the patient, blood sample from the patient, to screen all these systemic conditions. We will take an arterial blood from the patient by the syringe, put it in the laboratory tube, and centrifuging. This centrifuging will separate the components of blood, each part alone. This is the plasma, which containing about 55% of the whole blood, and this is the puffy coat area containing leukocyte, white blood cells, and the platelets, which comprise about 1% of the whole blood, and this part containing 45% of the whole blood, which contain the RBCs. This slide explains the components of each part of the blood or the separated blood. This is a sample of whole blood contains plasma, as we mentioned, and also contained red blood cells and white blood cells and the platelets. This is the shape of RBCs as we know in the biology. Also, the white blood cells composed of 5 types of RBCs. We can order this test as a for the WBCs, the WBC white blood cells differential. The WBC differential, in this test the laboratorist will get a result of each component of each type of the white blood cells, starting from neutrophils, eosinophils, basophils, lymphocytes and the monocytes. Some types of plasma proteins, also albumin protein, globulins, fibrinogen and also regulatory proteins. This is the types of proteins which can be presented and also can be evaluated in sample of blood in the plasma component. The first test which can be ordered, and I think it is the most type of test which ordered and can be getting from the blood tests, is the complete blood count, CBC. CBC containing the red blood cell level data about the red blood cell. The red blood cells also can provide us with an information about the total blood cell count, total number of RBCs, and the hemoglobin, which is the coloring part of the RBCs, hematocrit, which is the number of RBCs in the blood, and also the mean corpuscular volume, MCV, which is the average of RBCs in the blood volume, the average volume of RBCs in the blood. Also the erythrocyte sedimentation rate, which is the test of inflammation associated with inflammation or infection, cancer, autoimmune diseases, which is non-specific test, but also it is an important test to provide us with information about the systemic condition of your patient. So the test measure the total number of RBCs per volume of the whole blood, and the lower values can be founded in blood loss, hemorrhage, bone marrow failure, deficiencies of iron, folate and vitamin B6, B12, as well as when the patient complaining from hemolysis and certain cancers. High values can indicate high altitude patient, presented in high altitude patient, congenital heart diseases, cor pulmonale, which is a altered function of the right ventricle due to large disorder in the lungs. Polycythemia vera, also presented with high values of RBCs or the complete blood count. This polycythemia vera containing or indicating a stem cell disorder. And we have the pulmonary fibrosis and dehydration. All these conditions indicate high values of the test. The normal values of RBCs in males 4.45 to 6.2 million cell per cubic millimeter, and in female this normal value can be lesser, 4.5 to 5.5 million cell per cubic millimeter. Decrease in RBCs count can be seen in anemic patient, hemorrhagic patient, and also in liver diseases, and an increase can be seen, increased values of red blood cells count can be seen in polycythemia and extreme dehydration. These conditions indicate your patient complaining from polycythemia or severe dehydration. White blood cells data is one of the complete blood count test. The total blood cells, white blood cells, we called it leukocytes count, and also we have white cells count for differential types of white blood cells also can be ordered, and these are two very important tests which can indicate an inflammation or an autoimmune diseases or other systemic conditions. Also we have the platelet count and bleeding time tests. Hemoglobin test, also it's the amount of hemoglobin in the peripheral blood, reflect a number of RBCs in the blood. Hemoglobin constitute over 90% of RBCs. Decrease in hemoglobin concentration indicate your patient can be complaining from anemia and the increased polycythemia. Hematocrit, also called it a packet cell volume. It is a measure of the volume percent of packet cells in a whole blood. The hematocrit also can be determined directly by centrifugation. The height of RBC's column is measured in the tube. What is the height of RBCs? Also can be compared to the column of the whole blood. The column of the whole blood can be also compared with the volume or the height of the RBCs. As we mentioned before, the centrifuged blood, normal blood, will appear in the tube as 3 parts. The first part is plasma, as we mentioned, containing the components of plasma, protein, nutrients and hormones, and also the buffy coats containing the RBCs and the platelets, and the third part is the RBCs. So this tube containing a normal blood, so this is the normal distribution of the blood components, about 42% of RBCs, and this tube indicate an anemic patient, so this is a lower height of RBCs in the tube. This patient complaining from polycythemia, so the height of RBCs are increased height of the column of RBCs compared to the normal tube. Indications of CBC: when we should indicate complete blood count test, when we has a doubt in the patient having a anemic patient as anemia, so it is an important indication to order CBC when you think your patient having anemia. The history of blood loss can lead to anemia. History of pallor of oral mucous membrane, when you do an examination for the oral mucosa, you see that the oral mucous membrane are pale, and also pale conjunctiva, pale nail beds might indicate anemic patient. Evaluation of patient for general anesthesia: when your patient will undergo extensive surgical procedures, and he will undergo these surgical procedures under general anesthesia. So to tolerate the general anesthesia and to tolerate the surgical procedures, your patient should be fit. Unexplained syncope, excessive fatigue, and also glossitis, and the atrophy of the lingual papillae as we mentioned in the clinical examination, and also when your patient complaining from recurrent persistent gingivitis and stomatitis, you should order CBC. So your patient might have anemia. MCV is the measure of average volume of the RBCs and the size of it. Use of MCV results in classifying the anemia. So normal MCV indicate normocytic anemia. Normal or decreased MCV indicate microcytic. This means small cell size. And the increased MCV indicates macrocytic anemia. So there is a large cell size of the RBCs. Erythrocyte sedimentation rate at which the rate at which the erythrocytes sediment or settle out of the anticoagulated blood in 1 hour. So it's calculated by time. The normal erythrocyte sedimentation rate values range from 0 to 20 millimeter per hour. This is the normal values of erythrocyte sedimentation rate. So range from 0 time to 20 millimeter per hour. So this is the time at which, or the rate at which the RBCs settle or sedimentated out of the anticoagulated blood. WBCs, white blood cell count, a count of a total WBC or leukocytes count in 1 to 3 millimeter of peripheral blood. This is the amount of the sample of the blood should be withdrawn from your patient. Interpretation of WBC's count as this picture. Increase n, when the WBCs increases, we call it leukocytosis. It's increase in the cases of infection, leukemia, polycythemia, trauma, exercise, and after general anesthesia. These are the conditions when the WBCs are increased. Decreased WBCs, leukopenia, can be founded in cases with aplastic anemia, with influenza, with catarrhal jaundice, and also early leukemia, depression of bone marrow due to certain drugs, and also chemical toxicity and also shock. These are the conditions where the leukocytes decreased in number. Differential WBCs, we can order differential WBC with differential. Percentage of each type of leukocytes present in the specimen is measured. The types of leukocytes, as we mentioned before, are the neutrophils, which comprise about 70% of the whole WBCs, and also lymphocytes comprise about 47%, and the other lower percentage of monocyte, eosinophil, and also basophils. It's very important to indicate the amount of each type of leukocytes. So it is very important to interpret the amount of each type of leukocytes, which may indicate an important systemic condition of your patient. For example, the neutrophils can be increased in acute and acute bacterial infections, and also rheumatic diseases. Also thyroiditis. It is a cases, for example, in which there is an increase of neutrophils, which is one of components of the WBCs. Lymphocytes also can be increased in cases of chronic bacterial infections. So this is for acute conditions and this is for chronic conditions. Neutrophils can be increased in chronic bacterial infections and also in hepatitis and viral infections. Monocytes can be increased in cases of parasitic infections. When the patient had a parasitic infections, we can find an increase of monocytes in differential WBC. Eosinophils indicate an allergic Eosinophils also can indicate allergic reactions or allergic status of your patient, as well as the basophils indicate acute rheumatic fever and polycythemia vera. Platelet count also, it is an important test which can be ordered from the dentist or from you for your patient, which indicate an important information about the systemic condition regarding the bleeding and anticoagulation and also whatever related to platelet count. So the platelet count is the count of platelets or the thrombocytes in the total blood per cubic millimeter. As well, increased number of platelets can be found in thrombocytopenia, and increase we called it thrombocytosis. And these are the cases in which there is an increased or decreased amount of platelets. Bleeding time, when you will perform a surgery, either a minor surgery or extraction or whatever, and you have a doubt about the bleeding time of your patient, you will order bleeding time test for your patient. So it is the detection of the patient with bleeding problems, prothrombin or international normalized ratio INR, partial thromboplastin time, thrombin time, and bleeding times. All these are types of tests which indicate the bleeding condition of your patient. In this picture we will see an intrinsic pathway and extrinsic pathway of coagulation as we studied at the level 2 in physiology subject. As we see, it is a cascade of events, and there is the role of the coagulation factors. And platelet count also, the test can be ordered. Prothrombin time activated by tissue thromboplastin tests. Extrinsic and common pathway run with control. So we can use the international normalized rate. The normal prothrombin time, the normal is from 11 to 15 seconds. Prolonged time increase indicate abnormal condition of the bleeding time of your patient. Thrombin time activated by thrombin tests the ability to form a solid clot, run also with control. Normal values from 9 to 13 seconds. If there is a prolonged delayed time of thrombin time, indicated abnormal condition. IV bleeding time, test of the vascular and platelet status using the cuff of the sphygmomanometer. as we see in this picture. The normal values of IV bleeding time is from 1 to 6 minutes. If there is a prolonged time, so indicate the abnormal condition. This is a conclusion of blood tests and the normal values. In fact, when you order any type of test, the laboratory will provide you with the patient results and values of your test, and also the normal values, or what can be called reference value. So you will compare the findings of your patient with the normal values, and it's very important for the laboratorist to provide the physician or the dentist with the normal or the reference values. So since it can be differ from laboratory to laboratory, the normal values can be differ from system to system. Also, this is the second part of the blood test and the absolute and normal values. In conclusion, in this lecture we had talking about the blood tests, which can be ordered as an investigation to confirm your final diagnosis and to evaluate or assess your patient if he or her or she has a systemic condition regarding blood disorders or regarding any other systemic condition which can be evaluated or examined or investigated by blood tests. The assignment of this lecture: each 5 students must prepare a mini atlas of blood tests and their interpretations. This assignment also will be provided in the assignment section of this course as an attached Word document. It will be the assignment 4. Thank you, dear student, for your listening and your understanding. I hope that, and I advise you to read in the physiological aspects of the blood and also the pathophysiology of blood diseases, as well as in the laboratory procedures, in the laboratory aspects of blood tests. Thank you again.